marriage of biology and technology isn't just transforming medicine, it's transforming lives. That quote from Eric Topol, an American cardiologist, genealogist, and digital health expert, couldn't be more fitting for the conversation we're about to have today. We're diving into how medicine and technology are reshaping the way we heal, prepare for surgery, and optimize results in aesthetic medicine. I'm your host, Ken Umansky, and on this episode of techKNOWlogy, we're exploring a breakthrough platform that's changing the game in non-invasive recovery and tissue care, not through drugs or downtime, but through precision, energy, and cellular intelligence. My guest today is Dr. Nikolov, a board-certified plastic surgeon and internationally recognized leader in facial harmony and body aesthetics. His private practice, the Nikolov Center for Plastic Surgery, serves patients from Beverly Hills to Madrid and is known for delivering results that are elegant, natural, and deeply personalized. Dr. Nicholas has been a trusted voice in aesthetic medicine for more than 2 decades, with appearances on CNN, CBS, NBC, and Discovery Health. He's published and lectured extensively and continues to train surgeons around the world in his techniques. Today, as Chief Medical Officer of Cellsound, Dr. Nikolov is helping bring non-invasive ultrasound technology into the surgical conversation, helping patients heal faster and less swelling, better skin quality, and smoother recoveries. Welcome, Dr. Nikolov, and we're really happy to have you here on techKNOWlogy today. I appreciate your willingness to share.
Thank you for having me.
Well, I'm really glad because I'm interested in a lot of the things it sounds like you're doing, and I know my audience is. So let's just begin with your connection to Cellsound. How did you get involved with that company?
I used to work with another company which is InMode. It's one of the major players in the aesthetic world in the non-invasive and minimally invasive technology. And someone I used to work with came and brought this technology to me and said, look at this. This may be interesting to you. And to be honest, and I fully admit this, first time when he was talking about it, it's like, okay, this is too good to be true. I don't know if I want to waste my time with it. It's you're hitting every buzzword I want to hear, which is usually for me, my antennas are up. Nothing is that good.
Right.
So sure enough, he was persistent and came back around. And someone I trusted enough that I looked into the technology, and yes, I was one of the first few, very lucky to be that, in the country to use this technology and to be able to evaluate it and see what it does.
Okay. So I have a lot of tech-minded people in my audience, so I want to unpack a little bit what's under the hood. Can you explain the cutting-edge technology behind Cellsound and what makes it different from all the other treatments?
In a way, this is a very simple technology. In a way, it is not. But the simplicity is what makes it so great, at least in my eyes. It's unfocused ultrasound, and unfocused ultrasound is not uncommon. A lot of people have used it. But to differentiate it from focused ultrasound, where the waves meet at a predetermined point and deliver a large amount of energy, and as a result, you end up destroying tissue, whether it's you're trying to break up kidney stones, brain lesions, whatever it may be. In aesthetics, that usually one of the companies that come to mind is Altera, where it will destroy fat. But the reason it hurts is it's killing cells. This is unfocused. So the waves are going parallel to each other. They never converge. It's low energy. We're talking about 2 watts per centimeter square versus 10,000 in some cases of high intensity focused ultrasound. So it's very low energy, does not cause any damage to the tissue. That is all in well. And we know that low intensity, unfocused ultrasound can help heal tissue. One of the challenges has been throughout the years the fact that whenever you deliver this for more than 2, 3 minutes, you end up having this impedance that forms by the tissue, or if you think of it as resistance, that the waves no longer penetrate and they're no longer efficient. And as a result, the treatment is worthless. 2, 3 minutes and you're done. And if you think of going to your physical therapist, they may do some ultrasound. It's usually unfocused, but this ultrasound, they never do a treatment more than 5 minutes. And there is a reason. And 5 minutes is probably too long because after a while, it's not working. So what we've been able to do is create an electrical field that's synchronized with the ultrasound delivery. And when that electrical field is delivered in the area, we break down that impedance and we're able to deliver the effective treatment as long as we need to. And for those that all of a sudden they're thinking, oh my God, I can just go get a TENS unit, put it around, and that's going to work. Well, it won't. It's a little more sophisticated than that. But it's the nature of it is really that's what makes it that much better. And that's the real breakthrough.
So I've had a lot of ultrasound for diagnostic reasons. How is that different than what Cellsound is using?
Very similar, but the intensity is slightly higher, maybe 10, 50 times, but diagnostic is extremely low. But 2 watts per centimeter square is not something that causes any tissue damage whatsoever. And the reason that people like the treatments, it doesn't hurt, and it doesn't hurt because there's no tissue damage, but also there's no inflammation.
Okay.
And with all the things we've heard about inflammation, yes, it can heal tissue when you cause inflammation, but causing inflammation is not the best thing to do when you're treating someone, and especially if you're going to treat them for aesthetic reasons.
So is the treating them for aesthetic reasons, is the result long lasting, or is it you need to repeat it over time?
Well, that's an interesting question. And just like any procedure, just like any surgery or non-invasive procedure, you will have an improvement. However, what you do after that, it's on you.
Yeah.
You have to keep a good diet. You have to exercise. And it just changes the starting point from which you continue life. And what that would be, it's purely up to you. But whatever effect is, and just you said a bunch of techies listening to this and interested in how it works, because the questions frequently come up, well, how does it make the fat go away? The cells are not injured. However, they're thrown in a hyperresident state. As a result, they release the lipids, and the lipids go into the bloodstream. So the cells get smaller, but they're not damaged. Now, the next step of this, and again, anyone savvy would say, okay, great, but now I have all these lipids in my bloodstream. Where are they going? I'm not eliminating all of them. They're just going to go someplace else. And we have studies to show that treating with the ultrasound, the treatment we're providing, increases the metabolic rate, and also the lipids are preferentially used as a source, fuel source. So not only do we use preferentially lipids, but the metabolic rate is so much higher that we can burn them up. And if you test lipid levels do not increase.
Okay.
So that's some of the things that always will come to mind. And that was the first question I had. It's like, okay, well, they're just going to go someplace else, but they get burned out.
Oh, good. Okay. So let me ask the next question. Cellsound, it sounded like, was originally designed to help diabetic patients. Tell us the background story, how it evolved and into the treatment it is today.
You've done your homework. It's actually a very funny story. The inventor of the technology, Elon, his wife was complaining about her father having these wounds on his legs that were not healing. And I mean, Elon is a genius in every sense of the word. No exaggeration needed there. It's not a hyperbole. He kind of thought, okay, after hearing how he wasn't doing anything for his father-in-law, he just ended up coming up with this contraption all on his own just to help his father-in-law. And sure enough, it turned out his wounds healed. This was over 10 years ago.
Okay.
So afterwards, they started doing it on other patients. It's been used on COVID patients for lungs to clear out the congestion and lymphatics. But what this does and why I find it so fascinating and intriguing, and I think it's great for aesthetics. Yes, we all want to slim down, but the important thing is it opens up the blood vessels, keeping them open, clears out the lymphatics, so that improves collagenesis, collagen formation. That improves also the cell division rate, that it returns to a more youthful rate.
Mhm.
As a result, you have healthier tissue. So not only do you look better, you're actually healthier. And areas that just need to a little sprucing up, a little blood getting there, looking more youthful. It's not only about fat loss.
Okay. All right. So there's been advancements in all kinds of areas of medicine, especially in technology. How about in the technology of aesthetics and plastic surgery? Is it moving faster or slower? And well, what should we as laymen understand and expect in the years ahead?
It usually, at least from my experience, I've seen it move and big jump forward, and then you'll see improvements on that technology. Those improvements carry on for a few years. Excuse me. And then hopefully you get a new technology. And then there is a leap forward as well. The example I can use initially, let's take lasers and laser resurfacing. The CO2 laser, when it came out, you can make the skin look better. Of course, now we know their limitations. And yes, it still was used, but in a much more limited capacity. Afterwards, you had radio frequency. And a company, as I mentioned, I was involved in mode. You were able to tighten the skin, you were able to tighten the tissue. And of course, that was through causing micro injury, just like the CO2 laser and all others, erbium, etc. So it was creating thermal micro injury, sometimes not that micro, and it resulted in tissue tightening. You look better.
Mhm. Okay.
This is the next step where we can improve the health of the tissue while we are sculpting. And that's the differentiation. We no longer have to cause inflammation or micro injury, and we're still able to achieve quite a bit of a result.
That's great. Okay. So what kind of differences are you seeing, not just clinically, but how patients feel during the healing process? It sounds like you're creating a lot less damage. So therefore there's less pain. But how about the healing process? Is it so longer or slower or
There is no healing process.
it,
That's the beauty of it. There is no healing process. The protocol is usually 2 treatments a week for 3 weeks, so a total of 6 treatments. However, you can walk out 5 minutes later. Women usually would insist putting some makeup on, but not because of the treatment, because they came in with makeup and we took it off.
Right.
They will go out. If it's a facial treatment, nobody would be able to tell, except that you will see the skin glowing and looking better. And you will see an immediate difference. If you're doing it for the abdomen or the flanks and trying to reduce size, then you will see, and we have a photographic system that measures the difference, and you can see a difference in 2-3 centimeters. I mean, we've seen as much as 5, but again, I don't want people to think that's the norm of change in diameter by standardized photography with specific measurements that are consistent. And I mean, they can see it in the photo, but you can measure it as well.
Okay.
Once again, they can leave and they can do whatever they want. There are no limitations in activity and there's no recovery.
Well, that sounds like the ultimate, process.
Well, now you know why I thought it's too good to be true. I'm a skeptic.
Hey, me too, but that sounds like it's a breakthrough. For surgeons or clinics or patients or whoever who's just learning about this process, what's the one takeaway you want them to remember about Cellsound?
The sky's the limit, what you can do with it. I'm a plastic surgeon. I love doing surgery. I'm not a med spa. I can share so many different ways that I use it in my practice every day, from using it after a facelift to decrease the swelling much faster and patients look better, to using it after a tummy tuck where, excuse me, I can reduce the swelling once again and they heal better and they look better, to use it after liposuction, also multiple times on revision surgery. It appears to soften the scar, so I do a lot of revision surgery, and that's much more difficult. So if you can soften the scar, it makes my life much easier during surgery, and I'm much happier.
Yeah, I bet. Well, as usual, we've run out of time. I want to thank you for joining us, and us, I should say, for sharing all your insights, and for showing us today that the future of plastic surgery isn't just about what happens in the operating room. It's about what you can do before and after to make healing faster, better, and more complete, and even do away with healing altogether, which is really interesting and critical. Cell sound is proof that when you combine medicine and technology with care and attention, we don't just get better results, we get more human outcomes, and that's something we should all be trying and paying attention to. Thank you very much, and thanks for your time. And I know you're on vacation and cutting into your vacation. We really appreciate it.
Well, I hope everybody excuses the very casual look,
Go ahead.
but I'm at the beach, so
Yeah,
I hope everyone understands.
well, nobody's wearing tuxedos at the beach, so don't worry about that. Just like Cellsound is helping surgeons redefine recovery, Performix builds AI agents that help businesses redefine how they operate by streamlining processes, uncovering insights, and helping teams scale with speed and precision. Performix mission is AI for every business, which means creating solutions that are accessible, affordable, and deeply practical, from both marketing and all the way to CX to operations and finance. If you're curious how an AI agent could improve your team's performance or precision, visit performixbiz.com. Thanks again, everyone, for joining us on technology, and especially Doctor. Until next time, stay smart, stay curious, and keep innovating.